I'm very happy to be here with my colleagues also advocating for the movement of the GMAC into the medical assistance program. The physicians of Minnesota support GMAC moving in this direction. As physicians, our commitment is to our patients, all who are in this state. And our obligation is to give them the best care, the most appropriate care, quality outcomes, and great service. But we're also stewards of the financial and other resources. Most of the proposed solutions for GMAC have not been good ones. They've been challenged, and we believe there's an opportunity to make a shift. As has been pointed out, this is a very difficult population to figure out how to provide services, because they're people who need care, but we're not willing to pay for that care, and there aren't enough resources. And yet this is in the time where we're talking about health care reform. In fact, it's almost 2 years ago to the date that the legislature passed and the governor signed a direction for health care reform for the state of Minnesota. And yet, the action that's currently been proposed and has been legislated for this population is inconsistent with that direction set out for health care reform. What we need to do is focus on early diagnosis and treatment, prevention, and avoiding hospitalizations and other high-cost endeavors that our healthcare system can sometimes provide. It's best a situation that's best managed by promoting outpatient care, local care, community care, and avoiding focusing on the hospital. It's also a system that requires access to existing relationships that in many cases are long-standing, and the current proposal will break or help to cease to exist. And finally, we need to take access to federal matching dollars wherever possible. Whether you're on the left or right side of the podium, it doesn't matter. The citizens of Minnesota have an obligation for us to take access and obtain access to these funding. We need to make this change.